We have George with us today. George originally came in because he had some neck pain, referring to his shoulders, upper back. And he's been coming in for a few weeks now. He's been feeling much better. So with George, we're going to be working on his muscles, doing some myofascial work, removing any restrictions to the muscles. We're also going to make sure that all the joints in the upper back and neck are moving properly. What I'm doing here is just assessing, just static palpation to make sure that everything is gliding well, everything's moving properly. There's a few areas that are a little stuck. George is an electrician, so he puts his body into awkward positions over the head, reaching stuff. So it does place a lot of stress and strain on the upper back and neck muscles and nerves. Okay, the first thing I'm going to do is I'm going to loosen up the muscles a little bit. I'm going to apply some pressure to his muscle, and we're going to do what's called a pin and stretch. I'm going to pin that muscle and stretch it through his normal range of motion, making sure everything is pulling symmetrically from right to left, and everything's gliding properly. And we're going to shake his scapula down here. And we're going to use a vibropressor. The vibropressor helps to increase circulation to the muscles, loosen up all the tissues surrounding the spine. It feels actually really pretty, good. To loosen up the muscles, draw some blood and water nutrient all to the surface here. And we're going to do the traps and the paraspinal, the thoracic spine, all the way down to about the lumbars, addressing the whole lat muscle and deep muscle tissues. Find an area that's tight. We're going to apply a little bit of pressure and hold there for a few seconds. Go a little deeper. And now we're going to put some movement to the spine with the adjustment. These bones moving around. Any areas that are restricted or not moving properly, I'm going to apply a force here. Take a deep breath in for me, George. All the way out. Relax. Good. And again, exhale again. All the way out. Relax. One more time. All the way out. And we're going to do the same thing to the neck. Make sure those bones are moving properly and good alignment. Find anything that's out of alignment, we're going to move those bones to the right position. First, we're going to look at some of the muscles here. Same thing like we were doing in the upper back. Applying some pressure, moving that muscle to range of motion, opening up the trap. These muscles get shortened, especially when he puts his body into different positions at work. Okay, now that everything's assessed, we found areas that are not moving properly. Once you go motion here, get moving out. That's it. And this is stop. Now we're just going to reinforce his posture. This spends a lot of time, as we said, his head in forward flexion, so we want to mirror image of that. So what we're going to do is we're going to place his head into a little bit of tension. I want you to bring your shoulder blades together, just like that. And we're going to do a little stimulation. The muscle, the nerves here, this sends good input to the brain. Send the message back down to the postural muscles to help balance all the positions he puts his body. Back to center. All right, we're all set for today. Please join us again on another video. Have a good day. Thank you.